I looked around and I immediately started thinking like, well, this is like the ultimate playground for a physical therapy clinic. Because it's so different than anything else I had ever seen at that point. I mean, a clinic with climbing walls, a clinic with equipment that's designed for Formula One race car drivers. I'm the founder, one of the two founders and CEO of PhysioFitness. We came to start this clinic about a year ago. The equipment and everything was here already, but we added physical therapy services to this. Traditional physical therapy tends to use more weight equipment and maybe cardiovascular equipment. But there's a critical other difference in the approach, and the difference there is that typically in physical therapy, people work what's called an internal focus of attention, which means that physical therapists, and I was trained the same way, I must admit, physical therapists have a tendency to tell patients, put your foot here, put your left foot here, or if you have a back patient, tighten up your stomach, make sure you do this. And research has shown that that really does not work as well. In fact, it can actually interfere with learning new motor skills and doing your exercises properly. So what is very different in this clinic, that the equipment lends itself to giving people what's called an external focus of control. Can you knock out that light? Can you step on this? Can you push this object forward, or things like that? And there's a lot of research that shows that that works much better. Patients learn the skill much quicker, patients have much more fun doing it, and they're much more accurate. Hitting a golf ball works much better if you focus on the ball and not on your own posture. In fact, when you focus on your posture, straighten out your back, make sure you rotate, put your hand here, hold the club like this, you will never be a good golfer. What we can do here, we can go to equipment. I mentioned equipment for Formula One race car drivers. We can put you in front of that. It's a nice little frame with just little lights all over the place, and we can program them randomly in whatever order we want. We can make it really hard, we can make it a little bit easier, we make it for people who can barely do anything. But in the meantime, we may put you on an unstable surface. We don't tell you, make sure you keep your ankle straight, because that would be an internal focus. But what we do instead, can you knock out these lights as fast as you can? What they're really doing, they're training their brain, they're training their body from the bottom up and from the top down to incorporate the ankle back in the body schedule. They get their stability, they will train their ankle without knowing they're even doing it. We see young children in here, we see retired individuals in here. But the more we do here, that we realize that there really is no patient population where you cannot apply this to.
So Ehlers-Danlos Syndrome is a connective tissue disorder, and it can affect so many different systems in my body. I've been going to physical therapy for the past 9 years at different locations. I actually, when I started physical therapy for my conditions, I was actually in a wheelchair, and it was very beneficial for me at that stage in my illnesses. But now I've kind of graduated to a different stage of therapy, and that's where PhysioFitness comes into play, and they've been very helpful. I used to play sports all the time, and having my illnesses kind of ended that for me, at least for the time being. So to come here and to actually see equipment that get me active and kind of allow me to embody my sports and athlete persona again is just terrific and thrilling. So I was so excited, I couldn't wait to get on the equipment. I'm in different support groups for my conditions, and I've told almost everyone about it because I love it here and it's so helpful.
My name is Maria Oriini. I'm a physical therapist at both Bethesda PhysioCare and PhysioFitness. PhysioFitness is very different because it has a lot of equipment in the gym itself that is engaging. And the thing that I like the most about it is the clients are focused more on beating themselves, being competitive with themselves, trying to beat their last score, or even more competitive with other patients. I do a muscle relaxation technique called dry needling, where I insert a tiny, solid, thin needle into the trigger points in the muscles. They're like muscle knots, and it helps to release the muscle and helps to decrease the pain, muscular pain that these patients are in. In addition to that, I do a lot of strengthening, generalized strengthening, balance work, proprioceptive work down in the gym with the equipment down there. Yes. The Trazer is another piece of equipment that I call it the Wii on steroids. It basically is a big game on a huge screen in front of you, and it has a sensor that detects where your body is in space, and it can kind of track your motions. And a lot of people find this very useful, especially with EDS. You don't have a very good idea of where you are in space. So that proprioception, that ability to recognize where your joints are in space in order to get more points for this game, is a really, really good feature. I use that quite a lot. Kinesiophobia is a fear of moving. And a lot of times with the type of clientele that I typically work with at PhysioFitness, they have this disorder called Ehlers-Danlos Syndrome. And they have very loose connective tissue in the joints and throughout the body. And they tend to end up spraining a lot of joints, ligaments. They actually become afraid to move. And so they start to tighten up, they start to stiffen up, and they don't want to move. I had this one lady who, she would not go up and down the stairs for the life of her. And as she realized she could do things, as she realized she was getting stronger, now she can go up and down the stairs without pain. The focus is external. It's not, okay, you need to do this and lift your leg and, lift this number of weights and this many repetitions. It's more about a functional movement and having fun when actually exercising.
Okay, so I have Postural Orthostatic Tachycardia Syndrome, so everyone just calls it POTS for short. And basically it's a syndrome that causes rapid heartbeat, and when you stand up, so your blood pressure drops. So because of that, it causes a lot of problems like dizziness, brain fog, which is a thing where it's just kind of hard to concentrate and focus on doing homework, so it makes school really hard. And then it also causes things like it makes it hard to sleep sometimes, and joint pain.
Yeah, well. Over here. Whatever. Right here.
At other places I've gone, I just kind of sat there lifting weights and running on a treadmill and stuff like that. But here, there's a thing like a surfboard that you can stand on and you can play games. There's a laser maze, there's the sport wall, there's a glow-in-the-dark rock climbing wall. So there's so many things to keep you entertained, but you're also getting exercise. Yeah, that hurts. Well, now I have so much energy to get up every day, go to school, do extracurriculars, and just make it through the day without feeling horrible, which was really hard at first.
1, red. Blue, red, green.
My parents, every time we're sitting in traffic for half an hour, they're like, we're only doing this because it's really worth it.
I have Ehlers-Danlos Syndrome, hypermobility type, as well as postural orthostatic tachycardia syndrome. and it all affects pretty much every part of my body. So coming here with Maria helps make all of my body work together.
Drive approximately 66 miles each way. We live in Bel Air, Maryland. On an average day, it takes us approximately 2 hours to get here and 2 hours to get home, but it is definitely worth our travel time and sitting in traffic. Cassidy has made huge improvements in the last, I'd say, 2 months that she's been working with Maria.
I've been to several other physical therapy clinics that are very close to home, but they didn't treat me right. So instead of getting better, I got worse. And coming here has actually improved everything. So I really like the equipment because it's like fun and it doesn't make you seem like you're like doing therapy.
6 months ago, Cassidy was barely getting up off the sofa, and now her quality of life has improved, and she's looking forward to starting college in the fall.